What is dengue hemorrhagic fever? It is actually hemorrhagic fever se zyada, it is the leaking phase. It is the dengue leak fever, which is the leaking phase, which is important, which needs to be identified. और इसमें इम्पॉर्टेंट बात यह है कि अक्सर औकात मरीज सिम्टोमेटिकली उस वक्त पे फीवर उसका उतर चुका होता है, तो वो अक्सर ये समझ रहे होते हैं कि हमारा बुखार तो उतर चुका, अब शायद मैनेजमेंट की जरूरत नहीं है। लेकिन यही वो 48 आवर्स क्रिटिकल फेज के हैं जिसमें लीकिंग होने की वजह से और मिसमैनेजमेंट होने की वजह से इम्कानात बढ़ जाते हैं कि अनफॉर्चुनेट मोर्टेलिटी हो सकती है। सो वंस द फीवर इज डाउन, then the critical phase starts, and it is most important period where monitoring is required for such patients. And if it is not properly monitored, then the likely chance is that whether either patient is given extra fluid, which increases the leaky phase, or it can cause further damage due to the persistent antibody reactions which are present. We usually see thrombocytopenia in these patients. So thrombocytopenia, there are multiple reasons for this to occur. One is that there is low production due to temporary bone marrow suppression due to dengue virus infection, and this is an effect of cytokines. Another is that there is increased consumption, which is due to activation of the coagulation system, disseminated intravascular coagulation. Another is that there is direct infection of platelets with the virus, killing the platelets. And the last but not the least is increased destruction of platelets by activated macrophages. So all of them, any of them, can be responsible for decreasing the thrombocyte count. But one most important portion is that we need to know during monitoring that what is meant by this thrombocytopenia. When we are monitoring thrombocytopenia, especially for the critical phase, we need to know when they start rising. So if they start rising, that means that it is an indicator for the critical phase that it is ending. Bleeding can occur in these patients. So one of the reasons, multiple factors are there. One is thrombocytopenia. Another is the disseminated intravascular coagulation, which is affecting the endothelial dysfunction, and the presence of cytokines. All of them can be responsible for the bleeding. Similarly, disseminated intravascular coagulation and then poor perfusion of gastrointestinal tract can also lead to mucosal bleeding. So any of them or all of them can be responsible for the bleeding to occur. Similarly, drugs which are used. Another important point is that drugs like non-steroidals or steroids should not be used in these patients who are febrile and suspected of dengue fever. So my recommendation for them would be that for the first 2-3 days when the patient is running fever and you are not sure and you haven't done any investigation, please do not prescribe any non-steroidal to them. Just observe, and probably nothing is going to happen in the other than the aches and pains. Nothing serious is going to happen during the febrile phase. But you need to understand that giving a medication which can cause harm is more dangerous than actually providing relief to the patient. So which organs are involved in the dengue fever? There can be direct involvement of infection of hepatocytes or brain with the dengue virus. There can be circulatory failure due to poor organ perfusion, and there can be problem with the increased amount of paracetamol which is given. So paracetamol can also damage the liver, and it can cause different types of symptoms in these patients. Even acute fulminant failure can occur when an increased amount of paracetamol is given to these patients. Which organs are involved? Like these viruses may involve different muscles in the body, which can be skeletal muscles. It can involve pancreas. It can also involve the cardiac muscles. So myositis, pancreatitis, and myocarditis can all occur in the expanded dengue syndrome. Similarly, Guillain-Barré syndrome can occur. Stevens-Johnson syndrome can occur. And features can vary from one year to another and one epidemic to another, where different organs in the body are getting involved. So one of the important point is that one should not ignore and rule out that this organ involvement is not because of dengue fever. This is a separate diagnosis. One should think about the presence of, in the presence of dengue fever, that this may be organ involvement because of the dengue fever. Similarly, what is the ratio? Symptomatic patient versus asymptomatic. So there are more patients which are basically asymptomatic. Majority of the patients who are present to a doctor, they do not develop the leaking phase. They are simple dengue fever, DF. They do not develop any leaking. They are not DHF. So they do not go to the dengue shock syndrome, and they do not have the expanded dengue syndrome. So the ratio is 500 to 9,500. So you can just see that 5% of the patients usually develop symptoms out of the total number of patients who develop the dengue fever.